Hello, my name is Kirsten Steinbeck. I will be doing an NG insertion and removal and meds part 2. It is September 23rd, 2020. This is for NUR 400. So I already prepared everything. All of my meds, but I have one crushed med to prepare. And I'm going to go ahead and bring this into my patient's room with me. It's everything I need. So I will come in, provide hand hygiene, introduce myself to my patient, ask for their name and date of birth, and then I'm going to provide patient privacy and explain to them the procedure and everything we're going to be doing today, and I will ask them if they have any questions. I will do a full assessment on them, which I have already done, but then I'm going to go ahead and listen to my patient's bowel sounds. And you want to listen in each quadrant for 15 seconds. If the bowel sounds are normal, if the bowel sounds are absent, you want to listen for a full minute, and then have someone else come listen as well. So I'll go ahead and begin. So first I'm going to prepare my third med, with 10 to 20 mils of normal saline. I'm going to go ahead and use my pill crusher. I'm going to take my pill out, put it in the pill crusher, and crush it. Go ahead and dump my pill in there. And before I begin, I will go ahead and assess my patient's nasal airways to see which one is bigger. I'm going to go ahead and insert in the right, and then I'll make sure my patient has a towel ready and that they're in high Fowler's position. Next, I will begin. I'm going to go ahead and still air so I can check my placement when I insert it. And then I'm going to go ahead and measure. So I'm going to measure from my xiphoid process to my earlobe to the tip of the nose. Then I will go ahead and mark that with a piece of tape. So I know how far to insert it, and I'm going to go ahead and insert the end of my NG into some lube, about 4 inches. And I'm going to tell my patient that once we hit the oral pharynx area, I'm going to have them tuck their chin and take a sip of water. But to begin, we're going to tilt their chin back, and then I'm going to tell them that might be uncomfortable, but to bear with me. And then, so once we hit that area, we're going to have them tilt their chin in and take sips of water. And once we insert it, I'm going to make sure that their nose is free of any oils or anything that would make it hard for the tape to stick. We're going to secure it. On the patient's nose. Okay. And next I'm going to instill my air. And listen for a swish sound to check placement. And then I'm going to go ahead and continue by drawing back some residual. And I can do 10 to 30 mils. I got 20 mils of residual out. So I'm going to go ahead and keep this in my hand. So that way it's secure. And then I'm going to get a pH paper out to test the pH of the residual. So insert in there and it will end up being a certain color. And then I'm going to go ahead and secure my NG to the patient. So they're less likely to pull it out on accident. So once I've got it secured, I'm going to go ahead and begin with med administration. So I will go ahead and first flush with 20 mils of water. And then I will instill my crushed med. First. And go ahead and flush with 20 to 30 more mils of water. You want to make sure that you're flushing between each med. Then I'm going to go ahead and do another liquid med. And flush again. Here's 20 to 30 mils of sterile water. And then do the final liquid med. And flush again. 20 to 30 more mils of water. Okay. And then to remove the NG, I'm going to go ahead and unsecure it. Once it's completely unsecure, I'm going to tell them it might be a little uncomfortable, but just to breathe and relax best they can. I'm going to go ahead and pull it out. I'm going to wipe their nose, if any excess snot, and then I'm going to go ahead and document the insertion, the time, how the patient tolerated it, the size of the NG, as example 14 French, and then and how far I inserted it, and then I will go ahead and document my medications as well, and I will document how the patient tolerated that, and how much I flushed with for their oral intake, and I will go ahead and document my removal and all the characteristics of that.